How can you produce a larger load? Today, we're going to talk about ways to increase semen volume. My name is Dr. Rena. I'm a urologist and pelvic surgeon, and let's jump right in. First, let's understand what a normal semen volume actually looks like. On average, semen volume usually ranges from about 1.5 milliliters to 5 milliliters. In simple terms, that's roughly 1/3 of a teaspoon up to a full teaspoon. So in reality, it's not a huge amount. Many people assume their volume should be much larger for different reasons. One big reason is what they see in pornography, where the ejaculations often appear extremely large. But it's important to understand that those videos are produced with professional editing and special effects that make the loads look much bigger than they naturally are. In reality, those amounts are not typical. Another common belief is that the amount of semen someone produces is directly connected to their fertility, their virility, or their masculinity. That idea simply isn't correct. Semen volume can change for many different reasons, and we'll talk about those in this video. What many people don't realize is that only about 5% of an ejaculate is actually sperm. That sperm is produced in the testicles, but it's mixed with several other fluids before ejaculation happens. One of these fluids comes from the seminal vesicles. Their main role is to produce a liquid that helps sperm survive inside the vagina, which naturally has a fairly acidic environment. Another important fluid comes from the prostate gland. Prostatic fluid helps sperm move more easily through the vaginal canal. In addition, there's a small amount of fluid produced by tiny glands located near the opening of the urethra. These are called the bulbourethral glands, and they provide a bit of lubrication that also helps sperm travel more smoothly. Because only about 5% of the total volume is sperm, having a lower sperm count doesn't always show up as a noticeably lower semen volume. It can sometimes happen, but not always. That's why, if you're worried about fertility or trying to conceive and facing difficulties, it's very important to speak with a fertility specialist or a urologist who has specialized training in infertility. Another factor that can make a load appear larger is the force of ejaculation. This force depends on how strongly certain muscles contract. These muscles surround the urethra and are part of the pelvic floor, and their contractions help push the fluid outward. In a young and healthy man, ejaculation can actually reach speeds of up to 31 miles per hour and may travel anywhere from 6 to 9 inches away. However, this can decline as men get older. That brings us to some of the reasons why semen volume, or the strength of ejaculation, may decrease. One major factor is age. As men age, the muscles involved in ejaculation can become weaker over time. Another reason is that the prostate gland often becomes larger with age. When the prostate enlarges, the blood supply to it can decrease, which means the cells responsible for producing prostatic fluid may not create as much as they once did. In addition, when the prostate grows in size, it can slightly interfere with the pathway where semen travels. As fluid passes through the ejaculatory duct and into the urethra, the enlarged prostate may partially block that passage. This can reduce the amount of fluid that ultimately comes out. Another possible reason for lower ejaculatory volume is genetics. Quite simply, your genetics play a role in many aspects of your body, and this is one of them. Unfortunately, genetics are something you cannot really change. Hormonal changes can also affect semen volume. For example, we know that low testosterone levels are often linked with reduced ejaculatory volume. However, it's important to understand that taking testosterone supplements doesn't necessarily increase semen volume. Because of that, there's usually no reason to seek out testosterone therapy if your levels are already normal, since it likely won't improve ejaculatory volume. Besides testosterone itself, other hormone issues can also play a role. For instance, high prolactin levels or an underactive thyroid can lead to lower testosterone levels. The good news is that these conditions can often be treated with proper medical care. So if you're concerned about semen volume, it may be reasonable to speak with a doctor and have these levels checked. Certain medical conditions can also affect ejaculatory volume. Conditions like diabetes or spinal cord injuries may lead to problems such as retrograde ejaculation or anejaculation. Both of these issues can reduce the amount of semen that is released. Another factor sometimes mentioned is zinc. Zinc is an important nutrient involved in testosterone production. In the body, the prostate produces a substance called citrate, which binds to zinc. When zinc levels are low, the prostate may not receive the signal to produce enough citrate, which can lead to a reduction in prostatic fluid. That said, there isn't a large amount of scientific evidence showing that zinc supplements significantly increase semen volume. So this leads to the next question. What can you actually do if you want to increase your semen volume? Before we get into the specific ways to potentially improve ejaculatory volume, before we go further, I want you to take a moment and ask yourself why you want to increase it in the first place. Is it because you believe a larger amount actually increases pleasure for you or your partner? Or is it simply something you feel you're supposed to have? In a 2018 study that surveyed 240 women, only 13 said that a larger load or greater ejaculatory volume had any real impact on their pleasure. The vast majority of women, as I've mentioned in several recent videos, experience pleasure mainly through clitoral stimulation. That's how most women reach orgasm and climax. So in many situations, if your partner is able to reach climax, the amount of semen volume you produce usually doesn't make much of a difference. And the same question applies to you as well. If you're able to reach orgasm and climax, does having a larger load really change the experience? Now let's talk about what you can actually do to increase semen volume. The first and simplest step is hydration. Just like with many other functions in the body, when you drink more fluids, your body produces more fluids overall. This means you may notice more urine, but it can also lead to a greater semen volume. It's important to choose fluids that truly hydrate you. Water is always a great option. Try to avoid beverages high in caffeine or alcohol, because both can act as diuretics. Over time, they may cause you to lose more fluid through urination than you're taking in, which can slowly lead to dehydration. Another important step is quitting smoking. And if you drink large amounts of alcohol, it's a good idea to reduce that as well. Both smoking and excessive alcohol consumption can negatively affect semen volume and fertility. Beyond that, cutting back on alcohol and stopping smoking can bring many other health benefits. For example, many men are concerned about maintaining strong, long-lasting erections. Smoking in particular can damage blood flow over time, which makes it harder to maintain healthy and firm erections as you get older. So if that still isn't enough motivation, I'm not sure what else would be. But quitting smoking is something you should seriously consider starting today. The next point is that some research suggests longer foreplay may help increase ejaculatory volume. As I mentioned in a recent video about improving pleasure, spending more time on foreplay can enhance the experience not only for you, but for your partner as well. So why not take more time with foreplay, enjoy stronger orgasms, and possibly increase ejaculatory volume at the same time? Another effective way to increase semen volume is simply allowing more time between ejaculations. Studies have shown that for each day you wait, ejaculatory volume can increase by roughly 12%. Most recommendations suggest waiting about 2 days, or around 48 hours. After about 5 days, however, you usually don't see much additional increase beyond that point. So if your goal is to produce more volume, giving your body some time between ejaculations can help. Now, you might be wondering about zinc. Earlier, I mentioned that low zinc levels can reduce semen volume. So, should you take a zinc supplement? The research on zinc is somewhat mixed, and most studies haven't directly focused on semen volume itself. One study involving younger men found that lower zinc levels in semen, meaning lower zinc levels in the body overall, were linked with lower semen volume. That suggests zinc supplementation might help in some cases. However, a more recent study published in JAMA, a leading national medical journal, found that zinc did not significantly affect infertility. Because of that, it likely doesn't have a major impact on semen volume either. So I can't say with certainty that zinc supplements will increase volume. That said, if someone is actually zinc deficient, and that's something that can be tested, then eating foods rich in zinc may be helpful. Foods such as oysters, certain meats, nuts, and legumes are good sources of zinc. Increasing these foods in your diet could help restore healthy zinc levels and may possibly support semen production. More importantly, what really matters is maintaining a healthy overall diet. Try to aim for a balanced, clean diet at least 80% of the time. That means limiting highly processed foods, added sugars, and refined white flours. Instead, focus on eating plenty of fruits and vegetables, along with complex carbohydrates and quality protein sources. Those proteins can come from meat or plant-based options. Both can work well. Taking care of your nutrition supports your overall health, including heart health. And when your body is healthier overall, your sexual health often improves too. That may also help support ejaculatory volume if that's something you're hoping to increase. I hope you found this information really helpful. As always, remember to take care of yourself, because you truly deserve it.